The next question, the member for Scarborough-Guildwood.
Thank you, Speaker. My question is for the Minister of Health. The Toronto Star unearthed an internal report from the Scarborough Health Network that showed alarming trends. Roughly 14% of tests at Scarborough assessment centres comes back positive, which is triple the provincial average. There are outbreaks in 13 Scarborough long-term care homes. Scarborough's 3 hospitals are treating nearly a quarter of all hospitalizations in Toronto and Peel, and many Scarborough schools are in outbreak. Hotspot communities have not had a break since the pandemic began. They live in high-rises, multi-generational homes. Many residents are essential workers and in healthcare or elsewhere on the front lines, and they face higher risks of contracting COVID-19 with few options to self-isolate. Speaker, through you to the Minister, will you step in and provide the resources that are necessary for these residents in dense housing to stop the spread of COVID-19 by working with the federal government to set up
Thank you. Minister of Health.
The short answer is yes, we will. And I would like to read just a statement that we received from the Scarborough Health Network very recently. Our community is an explicitly acknowledged hotspot and has been for some time. This is a known issue, and we have been receiving support through Scarborough Health Network, Public Health, and Ontario Health. Resources to support testing, long-term care, and increased hospital capacity are aligned with a high community prevalence, spokesperson Lee Duncan said. So we are providing those supports with respect to testing, with respect to making sure that we can provide whatever supports the Scarborough Health Network needs. I will respond with respect to the issue of quarantine in my supplementary.
Supplementary question.
Thank you, Speaker, and I appreciate the hope that I'm hearing coming from the Minister of Health, because we do need more testing and we need more resources dedicated to these hotspots. Minister, the situation in Scarborough is unacceptable. The areas with the highest positivity rates have populations that are disproportionately low income. People are often from the Black community, Indigenous communities, and other people of color. They rely on transit to get around. In the recent Daily Bread Food Bank report showing poverty by postal code, and it uses the low-income measure after taxes, the Woburn community specifically stands out in deep need. It is not surprising that it is consistently high for COVID-19 positivity. Some of the hardest hit pockets of Scarborough have some of the lowest testing rates because they are isolated from the permanent assessment centres. The Scarborough Health Network is doing an excellent job with its pop-up assessment centres. I visited one last week and I saw the hardworking staff on the front lines, and they're doing all they can. But the solution just isn't enough. There's more that is needed. And Speaker, I'm asking you.
Thank you. Thank you. The Minister to reply.
Can advise that we are providing special supports to parts of Toronto that are hotspots, and there's no question that Scarborough is in that zone. We know there are a number of issues that need to be addressed, including the ability for people to have greater access to testing. That's why, in addition to the assessment centres, there are limited walk-ins for people that are not able, for a variety of reasons, to book online or to call to make an appointment. We also have pop-up centres and mobile testing units.
Response?
We are also working, many of the hospitals are working with units that are supply other health facilities locally to create that bond of trust and that relationship with people so that they will go in for testing, and they will also have that relationship when we're ready with the...
Thank you very much. The next question, the member for Thunder Bay Atikokan.
Thank you, Speaker. My question is for the Minister of Natural Resources and Forestry. Schedule 6 of the government's budget